So inflammation is what? It's a form of our body's response to what? Injury, stress, infection, disease, trauma, anything, right? That happens when you are alive. Because injury can happen when you're dead, right? Yes. Especially torture victims. But that's another course. It's FMed. So we go first when you're alive. And this is what? A series of events. And how would you know you have inflammation? Five things. You have rubor, calor, tumor, dolor, functionalisa. Functionalisa was discovered late, loss of function. But the four was discovered at the same time by Eli Mechnikov. Okay, let's start. Rubor, from the word itself, red. Dolor, pain. Calor, heat. Tumor, swelling. Functionalisa, loss of function. Who among you experience if there is a wound or something, but wound here, but the pain is here? Who had experienced that? None. Good for you. Let's wait when you grow old, right? Why? That's an example of functionalizer. The wound is here, but I'll tell you, my foot was aching last year. That's why I was having a pain. And now there's weakness. But the ache is not only on my foot. I feel it on my whole left lower extremity. Again, inflammation is an immediate reaction to harmful stimuli. Now, you're alive, but there's no, what do you call that? There's no inflammation when there's a harmful stimuli. What does it mean? Two things. I really hate that TikTok. Two things will happen. Ah, you saw that. What is that? Two things. Number one, you might suffering from CIPA, CIPA. You can feel pain and everything. But that's rare. What's much more common? Congenital insensitivity to pain and anhidrosis. You might be suffering from one. Anyone? Anyone? Hello. Hi. It's me. Yes, it's me. Anyone? Ah? Okay, good. Something to do with immunity. And what is that? And then what is that? Okay, good. What is that? You're suffering from diabetes. I'm still having inflammation. What's that? Ah? HIV? Why? You won't be having inflammation when you have HIV. You won't be having inflammation when you're having HIV. Because HIV will kill your inflammatory cells, your WBC. So what? So you don't have not no pain, but no inflammation. Pain might be there, but the swelling and everything won't be there. In CPA, on the other hand, you might be have swelling, but there's no pain. Now, I would like to ask you a question. What's the difference between a person suffering from tumor and an inflammatory reaction?
Tumor is long term and inflammation is short term.
You can have also a long-term tumor.
No,
What should you do?
tumor is short, tumor is long term. Inflammation is short term.
There is a chronic inflammation, which is long-term, can reach up to years. Anyone? Can the back people hear me? So anyone? Yes. Ask pa.
I was asking you the second case. Some people are born with it.
It's not some people who were born it. That's a genetic disease. So they are,
So mutation.
yes. And SIPA is still unexplained.
But the second is
Leukopenia is a disease that you have a low WBC. Yes, we go to that later. Okay, I'll answer that. I have a friend who has leukopenia, wherein her WBC is very low. Whenever she becomes sick, she her WBC becomes normal. Yes. In leukopenia, might be there is a problem with your bone marrow, or you have. When you yawn, please cover your mouth because when I see you yawning, it's contagious. I will yawn. And what I have heard was there was a lecturer while having a recorded lecture yawn in front of the camera, and that lecturer was kicked. No, it's not here. In another. So I don't want to yawn. No, but what does it mean when you are yawning? You feel sleepy. Yes. Why are you feeling sleepy? No, no. I heard. Yes, your oxygen is low. Yes. So I advise you to bring a oxygen tank if you want. Now you know why I'm cracking jokes, right? Okay. Where are we? Tumor. If the tumor, if you palpate the tumor and it's painful, that's tenderness. There's warm, that's heat. Those two, chances are that is a inflammation because tumor when you palpate it, mostly it's not tender. Okay, these are my contents. And as you can see, there are two things. There's an acute inflammation and a chronic inflammation. And these are my learning objectives. I hope these learning objectives are what's this? These learning objectives are met after the lecture. Oh, I forgot to say. There's another one. Inflammation. What do you mean by repair? Regeneration or what? Healing. You can switch off the lights now. A while ago, I was putting my password. That's why I asked you not to switch off the lights. You can switch off the lights. Someone was switching off the lights a while ago. Why? Sa, do you want my cane so you can reach it? Ah? Nah, I'll be doing that also. Okay, acute inflammation. Okay, to tell you frankly, I'm having troubles looking for images. That's why I haven't finished your third slide, your third topic, because I'm putting images for you. Is it okay next lecture I won't be having any more images unless it's really needed? Okay. Acute inflammation, this is what? The rapid frontline. In short, if there's something went in your body, I call them the welcoming committee of your body. Will welcome them. If it's harmful, they will attack it. If it's not, they will still survey it. Surveillance. So, cardinal signs, as you said, what? Redness, heat, swelling, pain, and loss of function. This is because of what are those? The chemical mediators. What are those chemical mediators? Your cytokines, chemokines, leukotrienes, prostaglandin, and complement. What is a complement? What is a complement? A compliment is something like when you're doing good and they said, hey, you're really doing good in the exam. That's a compliment, right? A complement in pathology, on the other hand, is a series of events leading to killing of that microorganism. Am I right? So, what are the vascular events? First, you have a break on the skin. Then, once there's a break, there will be vasodilation. Why? For those inflammatory cells to go in. Am I right? After that, there will be now leukocyte coming. Why? Those leukocytes will kill what is foreign, and platelets will also come to what? Clot the. But that's another story. And after that, what will happen? Transmigration of the inflammatory cells. Again, chemical mediators are still the same. But instead of having, what's this? Leukotrienes, you have this vasoactive amines. Okay, I'll change my view to the slide also. So acute inflammation, it's a rapid onset, minutes to hours, with short duration. That's Rain. Yes. Timeline of inflammation. Again, vascular changes, there will be vasodilation. In seconds, it will vasodilate. increase blood flow, and in minutes there will be edema. Then after that, leukocyte recruitment. Why will you be having edema? Okay, then okay, can be. And ours today's there will be what? Leukocyte recruitment, selectins, and integrins. And you go to resolution or progression or what? Regeneration, tissue regeneration, and progression to chronic inflammation. If you progress to chronic inflammation, you can still what? Heal, but there's no tissue regeneration anymore. Heal, repair, or apoptosis, necrosis, not apoptosis. Cellular events in acute inflammation. The rat. What do you mean by the rat? Leukocyte invitation, they will be coming. Then they will be what? Rolling to the blood vessels until they go to the site of injury. Then those WBC will what? Adhere, and they will migrate to that. Oh, someone saw my. Who is this? Really? Why? Give me one good reason. They will migrate. The leukocyte will try to squeeze in between those endothelial cells that is destroyed and try to fight off that microorganism. Am I right? What are the patterns of inflammation? Actually, there's a lot, but this is the three main one. A serous pattern, which is watery exudate. A fibrinous pattern, which is fibrin rich. This is mostly some neophytes, noob, newbies will think that this is what? Pus. But when you look at under the microscope, there's no dead white blood cell or bacteria. But there is what? It's like scarring formation, fibrin. They are trying to clot there. And the purulent inflammation, these are now the past. It is also known as what? Abscess. Serous, an example for serous inflammation is blisters. Have you experienced to have blisters? All of you? What do you do when you have a blister? Who said pop it? No, I heard pop it. Who said pop it? Ah? Vishal. When you pop a serious inflammation, the tendency is it might get infected. Doctors will pop it, but you should not be popping it because what is your materials or what is the equipment that will you be using to pop it? You hit a needle in a flame. Yes, a pin within a flame. There might be microorganism. If there's no microorganism, that the black soot that goes in contact with the flame will also slow down the healing process. Chronic inflammation, slow onset, long duration. Here, you'll see now chronic cells like macrophages, lymphocytes, plasma cells. And there will be what? Tissue destruction. And if you try to look it under the microscope, you'll be seeing angiogenesis. What is angiogenesis? Blood vessel will develop. New blood vessel will develop. That's a sign of chronic inflammation. Worse comes to worse, there will be fibrosis. It was repaired, but there will be fibrosis. For those who stayed here last Tuesday, you have seen fibrosis when I showed you my foot. That's fibrosis. Another one for chronic inflammation is what? If the body cannot heal it, it will go to necrosis. There's one thing I need to tell you here with chronic inflammation. Ah, worse comes to worse in chronic inflammation, because it's long standing, there will be now what you call calcium accumulation. And when there's calcium accumulation, what kind of calcification is that? Dystrophic or metastatic? So dystrophic or metastatic? Who said metastatic? Raise your hand. Yes, I know if you're raising your hand. Who said dystrophic? Raise your hand. No one's raising their hand. I can see someone's that's laptop light, right? Because it's too bright compared to a cell phone light. Guys, our next lecture, I would like the lights to be open. Dystrophic or metastatic? Calling once, twice. If there is calcium deposit, what kind of calcification? Dystrophic or metastatic? Anyone? Dystrophic or metastatic? Yes, my voice is back. Dystrophic? Okay. But the calcification moved to the. That's why it's between dystrophic or metastatic. Are you sure? Are you sure? Dystrophic or metastatic? Okay, I'm teaching you guys. Your answer is correct. And you need to have that confidence as well. Now, when you're gone, sure, let's have a bet. And you keep having your gone. Okay. Wow, Abby, are you sure? Yes. And then with Abby, okay. I don't know if you are really giving out. Do you agree with that? Even if I repeat you. Do you agree with that? Even if I repeat you. Because of your even the static, remember, there's one thing you need to remember in the static. There is a problem with your calcium. Your calcium is high. We're not talking about the high level. It's about the you understood? You understood? Yes. Okay. So attempts at healing, angiogenesis, and there will be fibrosis. Have you seen some wound that is healed, but the skin is not that? The scar is not, no, not scar. The skin is not that smooth all. Because there's some wound when it healed, the skin is still smooth, right? So that's fibrosis. It's scar formation wherein the scar is not really that well. Mostly you see fibrosis in secondary wound healing. Secondary, primary. Secondary. Granulomatous inflammation, special form of chronic inflammation. These are what? Aggregated of activated macrophage. When I say activated macrophage, what is the first thing? What is the most common macrophage, activated macrophage that you'll think of? You're joking me. You have five white blood cells: neutrophils, lymphocytes, macrophage, eosinophil, basophil. And you're telling me activated macrophage is neutrophil? Yes, eosinophil. Go. What is the most common activated macrophage? Monocyte. Monocyte is a macrophage only seen in blood vessels. Once they go out to the blood vessel, because we're talking about tissue, they are macrophages. Hmm? Yes, and macrophages. But I'm asking, what activated macrophage have you encountered already? Because I mentioned an activated macrophage last lecture. Starts with the letter L. Lymphocytes and macrophages. Leukocytes is a white blood cell and macrophage is a white blood cell. I'm asking the answer. What is that? Wait, can I see the edition of the Who gave you the clue? Huh? Okay. Who's your translator? Where's Anna? Anna, where did you get that clue? Who's that senior? Huh? I'm sorry to tell you, I'm not using the name. I'm using the 11. So starts with the letter S of mathematics. I mentioned that last time. Leukocyte. A macrophage is a leukocyte. So I'm asking, what is that specialized macrophage? Yes. Because if no one answers, I'll be calling my former students in let's go back to me. What specialized macrophage? Thanks. Gloria. Where's Gloria? Gloria. Yes. What's specialized macrophage? Elodie. Huh? Microphone macrophage? No, just a part of the microphage. Hindi mo kayo sa kind of type of I'm asking for the specialized macrophage. Huh? Lamans? Lamans? What is a lamans? Are you sure it's lamb hands? Or longer hands? Longer hands is for the first game. Lamb hands is a specialized one. But describe a lamb hand cell or lamb hands giant cell. Ah, I said describe. I'm asking words to be seen. Again. It's not using. Horseshoe shape? Is it a horseshoe shape or a U shape? Both are the same. What's the shape of the Why am I telling you this? Because some books really, when you read it, they say it's a U shape. Some books say it's a horseshoe shape. For me, it's an incomplete oval. No, and always, but the problem is it's they don't eat them. A Langerhans cell is a specialized macrophage seen in granulomatous inflammation. That's one of the specialized macrophage. Assignment. What are the other specialized macrophage? Or what are the yes, what are the specialized macrophage? Mostly you see this in tuberculosis, the Langerhans giant cell, fungi, fungi. Yes, we have a debate here. How do you pronounce fungi? Fungi. In America, we pronounce this as fungi. In other, one of my students is it's fungi. Yes, fungi. Yeah. So I told them, is Jasmine here? Where's Jasmine? Jasmine, are you here? You'll be understanding this. I told them, okay, to take out the debate how to pronounce that word, amag na lang. Wala pang away. You understood that, Jasmine? Amag na lang, wala pang away. You understood? Amag is the Tagalog word of fungi. So, wala pang away, we won't be fighting for it because that's how we pronounce it. Until that student was reporting about fungi and that student, that certain students is pronouncing how I pronounce fungi now. It for me, how you pronounce it is different. You can pronounce it as ever you want. But if I ask you to spell it, make sure you spell it right. Because when I was discussing about liver, doc, it's not liver. When I was starting here, doc, it's not liver. It's liver. Wow. Liver. You want a cup of tea? Liver. Exam king, essay. Exam king, essay. He was mentioning about the liver. I wait for you to drink that because you might spray it on me. And he spelled it like Liba. Wow. Liver. And I put that student part of the X-Men. What do I mean part of the X-Men? A big X. Just remember this. We have a diverse lecturer. And the problem with English, there's an American, an English, and I just learned there's a Chinese English, a Korean English, and everything English. Yes. So make sure that you understand that it's not how they pronounce it, but it's the accept also. We'll try. I'm trying to pronounce words like an American English or British English. Especially when my son came, my youngest son, Paul, I was talking to him. When he came here, I cannot understand how he talks. It's an Australian English. Yes, he learned it from Peppa. Yes. And when they came here, we have a lecturer who is from Australia. And Paul was talking to him, and both of them were understanding each other. And now, my eldest is also has a playmate from UK online. And if you hear him how he talks in English, yes, the bloody English. It's like I'm talking to Harry Potter, Ron Weasley, Tom Holland. Okay, chemical mediators of inflammation. So you have cytokines. These are the one that you're mentioning a while ago. Cytokines, TNF, and interleukin. Remember these two, the TNF and interleukin. If you have these two, if you have these two, what does it mean? Fever. Remember that. TNF and interleukin 1, you have fever. And the substance of this is responsible also for cachexia. What is cachexia? What is cachexia? Now I call energy. Yes, I know. Energy. What is cachexia? I discussed that in part of the community, right? Yes. Inflammation, I didn't discuss in part of the community. Gloria? Gloria, I know that you're so saying no. So energy, what is cachexia? Because if I cannot answer, I'll call from. No. Chemical concept become without particles because of what? Remember, people with cancer, right? Their muscle becomes smaller. Why? If I mention a word, will you be looking for it? Look for warm words instead. Warm words. W-A-R-B-R-D. What is a warm word? No, I mean that. No, I feel that you'll be writing a lot in your final exam. The last time I gave like a final exam like that, they wrote from cover to cover and asked for extra pages. Why? Because they said my students finished the exam early. They finished the exam at less than. So to make sure you stay in the hall, I ask you to write 500 pages, right? Guys, if I give you an essay, please, and please. If I ask you to describe the scene, do not describe the book. I will like to describe the scene. If you try to beat around the bush, I'll beat your feet. Are we clear? So in people with cancer, their muscle cells atrophy. It's called cachexia. And it's because of what? What cytokines? TNF and IL-1. Then we go now to this lipid mediator, arachidonic metabolites, prostaglandin and angiotensin. This prostaglandin and angiotensins regulate arachidonic acid, generate fragments. This fragment is called what? Your complement system also. This complement system, on the other hand, generate promote oxidation. What is oxidation? For example, this is your microorganism. After this, we'll have a break. This is your microorganism. Then comes your complement, which is your membrane attack complex. This membrane attack complex tries to what? Enlarge the what? Tries to enlarge what? Hello? They try to enlarge that microorganism so it will be caught. Imagine your body is like a building. To detect someone comes on that building, a espionage, a spy, you need to enlarge all the pictures of those spaces. Am I right? That's like the complement. Okay, can we have a break? Okay, let's have a 30 minutes break. What's this, lunch? Okay, switch off the lights, huh? Okay. Hello. Outcomes of inflammation. When you have injury, there will be inflammation. So what are the outcomes? The first is resolution. Resolution. In short, it will heal. We also call this as regeneration, wherein it happens when you have a abrasion. What is an abrasion? What is an abrasion?
Abrasion. Abrasion.
Oh. What is an abrasion? Superficial injury because of friction, right? In short, abrasion is an injury wherein the basement layer of your lining epithelium is still there. That's why it will be simple regeneration or resolution. Another is fibrosis. This is now, what do you call this? A deep wound or fibrosis. And if this doesn't resolve, it goes to what? Chronic inflammation. This is a progression of your injury. So, as I told you, regeneration versus fibrosis. Regeneration, replacement of normal cell because the basement membrane is there. But fibrosis, now the basement membrane is taken off. There will be what? Injury. We're talking about people without any comorbidity. For diabetic, sometimes they have abrasion, but they go to fibrosis. Why? Because their wound is slowly healing or worse, non-healing. Now, wound healing. There is also what you call a primary intention or a secondary intention. A primary intention is a clean wound and it needs to be sutured. A secondary intention or large wound needs more granulation tissue and there will be contractures. Mostly in primary intention, you do regeneration and there will be a small linear scar. On the other hand, secondary intention, there will be fibrosis. This is what they call you need to granulate. So every day you are cleaning that wound, taking out the old cells so new cells will come in until, for example, the wound is like this until it closes like this slowly. First intention, the wound is like this, then it will close like because you sutured it. Sometimes first intention there's no suturing, but it will just heal naturally. Factors affecting healing. Most common is infection. If there's infection, there will be pus formation. It won't heal because there will be dead debris. Next is diabetes. Why? Because of your blood vessel constricting. Less blood flow going to the okay. Nutritional status. Why? In healing, you need what? Protein and what? Iron. What else? Vitamin C. Why vitamin C? Collagen formation. Because when you are healing, you need collagen for the repair. And if you don't have vitamin C, your collagen will not be repaired. And protein, if you don't have protein, collagen cannot be make up. Steroids. Why? Because your immune system will go down if you have steroids. Those people with steroid has a slow healing progression. Mechanical stress. What does it mean? Which one is healing faster? A wound here or a wound here? A wound here or a wound on your forearm? Forearm, right? Because this is what you always use it, and it, for example, it healed, then you move it. You understood? Poor perfusion, still the same as diabetes, the microcirculature. Hi, Sad. How are you? Do you want to talk? Yes, you can talk. Yes, Sad. Then foreign bodies. When you were young, who among you experienced they are putting antibiotic powder on the wound? None? Ah, you have experienced that, right? Yes. The practice of our elder generations. What do you call them? The lost generations. Yes, because I'm still in generation. I don't know. But basing on the person said that was I am a very, very old man. That picture. What do you call it? The elder generation. They put antibiotic powder in your wound, but that's not right. Why? It delays the healing. It's a foreign body. Doc, why do we need to suture the wound? That's a foreign body, the suture, right? Yes, you need to suture the wound, but it's not on the wound that you are putting the suture. It's on the skin. No, in the skin. That is what? Normal skin near the wound. So there will be you're introducing another wound, but a pinpoint wound. If you introduce a pinpoint wound, it will heal faster. Any questions? Well, don't worry. Akshay Kumar is teaching me Hindi also. Any questions? No. My point here is I would like you to read rather than I'm reading my notes. I think I would like you to read and put notes. Especially those people, I see them taking pictures of my slides. Yes, right? Right? Let's see, let's compare their grades in the exam and those people who are not taking pictures of my slides. Let's compare. I'm just joking. So, any questions? We have a very long time. And as I told you, I haven't finished the third chapter. The third lecture. The third lecture is about shock. Shock. Yes, it's something like this. I asked you to have a reaction paper and submit it. So, reaction paper. I have read the book and this is my reaction. Reaction paper, right? Yes, that's hemodynamic disorder. Why shock and hemodynamic disorder are the same in one topic? Because shock is more on your blood flow. And yes, yes, go again. I didn't understand. Sorry. Warburg effect. Can be used in fetus, can be used in neoplasia. Yes, there's someone raising. I think that's a visual. A visual, you're raising your hand. Someone raising their hand a while ago when that was Etika, right? Any questions? It's like a GIF, right? Sometimes the right path is not the easiest one. Yes. Even inflammation, they need to what? Go to those endothelial spaces. And it's like medicine. It's not because you're the only one doing it means that what you're doing is wrong. And it's not because everyone is doing it means that they are doing it right. Am I right? What else? Like in this meme that I said, I shared to most of the students. When the time comes when you study and you feel that you are now lazy, go out of your house. Yes, go out of your house. Because if you fail your exam and you fail your course, you'll be feeling now a lifetime what happens if you feel lazy. Am I right, Riel? That was the meme I sent you, right? When you feel lazy when you're studying, go out of your house because you will be feeling the effect if you fail this exam.
Yes,
Actually, I have shared that to a lot of students. Yes. And just remember this. Just remember this. Two things I just realized yesterday. Number one, number one, your grades, your grades doesn't manifest how you perform, but it only manifests how well you understand. Yes, how well you understand. Okay? And another thing, and another thing, I don't have a mic. That's the generator. And another thing, just remember this. There will become a time you'll realize your patient is not a multiple choice anymore. Yeah. That's not a, so like what I told you, right? This will not turn on. That's why I don't want anyone. So any questions? Okay. If none, can you switch on the lights now?